Welcome to my channel, Brainies. Today we are going to discuss about the topic Arnold Chiari Malformation. What is Arnold Chiari Malformation? It is often referred to as Chiari Malformation, which has been named after the author Ernst Chiari and Julius Arnold. It is nothing but a structural defect in the cerebellum which controls the balance. This condition is usually characterized by the displacement of the cerebellar tonsils, that is the lower part of the cerebellum, through the opening at the base of the skull known as foramen magnum and into the spinal canal. So this is a picture depicting the Chiari malformation, and this is a normal brain which is continuing as spinal cord. So you could see the tonsillar herniation at the level of the cerebellum in Chiari malformation and also the presence of syrinx. So there are four types of Chiari malformation. Type 1. The cerebellar tonsils extends into the foramen magnum, but it doesn't involve the brainstem. This type is often asymptomatic and sometimes it may cause mild symptoms. Type 2. This is also known as Arnold Chiari malformation. It involves the extension of both the cerebellar and the brainstem tissue into the foramen magnum. And this type is usually associated with myelomeningocele, which is a form of spina bifida. The next type is type 3, which is a more severe form where the cerebellar tissue and the brainstem protrude through the foramen magnum and into a sac-like structure. Type 4, which has been characterized by an underdeveloped cerebellum, and it may lead to hydrocephalus also, which is nothing but the accumulation of CSF in the brain. The symptoms of Chiari malformation includes the following: headache. Sometimes it is present at the back of head, that is at the occipital area, which may be made worse by coughing, sneezing, or even straining. Symptoms continues as neck pain, dizziness, balance problems, hearing loss or tinnitus, muscle weakness and paralysis, visual problems. Sometimes it may be associated with nystagmus also, swallowing difficulties, dysesthesia in the limbs, problems with hand coordination and fine motor skills. So diagnosis of Chiari malformation, it includes the medical history, which includes the symptoms and the progression of the symptoms. Neurological examination involves the assessment of the reflexes, muscle strength, coordination, balance, etc. Imaging studies like MRI, it is used to visualize the brain and the spinal cord and identify the extent of herniation. Surgical interventions. Myelomeningocele repair and management of neurogenic bladder can be done. Ventricular shunting, which improves the cranial nerve and the brainstem function. The craniovertebral decompression, which may be required in case of neonates with brainstem dysfunction. Physiotherapy interventions. So physiotherapy plays a major role in case of Arnold Chiari malformation. Vestibular rehabilitation can be indicated when patients have vestibular problems. Conservative physiotherapy like soft tissue techniques can be beneficial in case of cervical pain. Soft tissue techniques may be beneficial for headaches, and regular follow-up and monitoring may be necessary. So thank you for watching. Kindly support by subscribing and sharing. Meet you all in next video. Thank you once again.